So thank you all for joining us today. We are here today for our webinar on resilience, coping, and self-care considerations on managing compassion fatigue. Today we have with us Kimberly Johnson, and Kimberly Johnson is an assistant professor in the Touro College School of Health Sciences Clinical Mental Health Counseling Program. She is a national lecturer and a private practice clinician in Long Beach, New York. With over 20 years of direct and administrative clinical experience, Dr. Johnson has specialized in, specialized in working with members of the deaf community and within the traumatic stress field. Since her work with first responders in the aftermath of September 11th, she has been active in various community-based response programs. Since May of 2020, Dr. Johnson has had the honor of being a volunteer and now board member with the Emotional PPE Project, providing mental health emotional support to COVID-19 frontline healthcare workers. As a volunteer with the Emotional PPE Project, she has worked closely with the emotional fatigue and trauma faced by our frontline workers from within various professions. Dr. Johnson is a certified compassion fatigue therapist and educator, certified compassion fatigue professional, certified clinical trauma professional, certified field traumatologist, and a diplomat in the American Academy of Experts in Traumatic Stress. Dr. Johnson is also honored to serve on the board of the Long Beach Community Organizations Active in Disasters and as a co-founder and initiative coordinator for the Couch on Wheels Foundation, providing self-care, training, and services to caregivers in our community. So I will take this opportunity to turn this over to Kimberly. Kimberly, thank you for joining us once again.
Oh, Christy, thank you. And I'm very honored to have been invited back. I hope some of you out there have been part of this before and that some of this will sound familiar. And I know this is such an important topic. So thank you. I guess I'll just jump right in if that's okay with everyone. I'm going to share my PowerPoint, and then really my intention is to go over and touch on some of the concepts we've talked about previously about compassion fatigue, how it impacts us, and kind of how we're conceptualizing it now professionally out in the world. And then I want to introduce the concepts of our own resiliency, our own coping and self-care from a real positive kind of strength-based approach. I hopefully will kind of roll through some of these discussions, and I hope your questions become a big part of this. Please put them in the question and answer. They can be anonymous. And Chrissy will make sure that they get moderated so we can talk about questions or concerns you have. So I'm going to go ahead and jump kind of right into that. So bear with me as I share my screen and get started here. Okay. So as Christy said, I'm Kimberly Johnson. I am a board member for the Emotional PPE Project. If you're unfamiliar with it, I sure hope you look it up. It's at emotionalppe.org. We are an organization that comes out of actually a community need. So Dr. Dan and Dr. Ariel up in Boston saw that the residents and frontline workers in the hospital up at Mass General were really struggling in the face of COVID-19. And they decided that, hey, something needed to be done. And they put together this program that has now served well over 1,500 of our healthcare professionals in all walks of healthcare. And we're not just talking about MDs and, RNs, but we're talking about speech and language professionals and our respiratory therapists and our techs, and across the board. And they reach out, and it's a way for them to get free, confidential clinical support as they deal on the front line. So I'm very proud to be part of them and part of that. But in the meantime, is we kind of what I brought in through my work with them, and what I kind of want to bring in for you all is this discussion about compassion fatigue, really looking at some of our strengths and things we can do to kind of combat it and deal with it, both personally and professionally, because it just kind of seeps into every part of our life. So as we start thinking about the stressors and what we've been through in, since, for many, since January of 2020, some before, the stressors of what we faced with because of the pandemic have not left none of us unchanged. I mean, we're all changed by this. We've all been impacted, maybe only professionally, maybe personally, but I would suspect for most of us, it's both, that we really have changed how we live our lives, how we do our job, how we interact with our support systems. And because of that, and because of the consistency of the unknown of what our world looks like, we're kind of constantly in this state of stress and trying to deal with kind of this lack of control in various parts of our lives leaves us constantly dealing with the stress that this kind of brings up. So as we talk about this, we need to sit and remind ourselves that we're not alone in being impacted. But it also means that we have to start to acknowledge and look at how we've been changed and how things have changed within our profession, within our environment, our families, our social circles, our communities, et cetera. And this idea of our professional and self-identity is something to consider, like, where are our boundaries now? How have our actual jobs changed? How have the reasons that we've gone into our profession changed? How has our description of our jobs changed? Christy and I had a nice conversation before everybody came on. And this idea, and she even brought it up, and I think that's very important. And for me, it's the same. Suddenly I'm virtual. I'm no longer in the same room with either my students or my clients or even my peers. I now spend so much of my time virtually. And when we're together, we're often masked, which does change kind of some of that dynamic of how we interact with each other. And it does impact that kind of professional like interactions in our professional identity. It also changes how we look at the people we serve and how our jobs actually work. One of the things that's come up that I've heard about from nurses is that how they developed that rapport with their patients in the hospital room has changed when they're fully masked. Now everything is where you might smile, or there may be those facial expressions that you might exchange with somebody. That's not there now. And I suspect from many of us in professions outside that hospital setting have that same issue, that you don't know sometimes if somebody's smiling, you don't know if somebody is, biting their lip and holding back certain amount of emotions that we may not see. It does change the dynamic because we're now in this state where our masking does really influence us. We also have to think about how this is, and we call it sandwich. We're kind of the sandwich generation. For many of us, this time right now, professionally, we're both maybe taking care of our elders, our family members, parents, siblings, in my case, with older siblings, and then also children and people, that we're also caregivers for on the other end of the spectrum. We kind of get smashed dealing with so many things. And then in the professional sides, there's that sandwiching also, where we may have our commitment to our patients and also our commitment to our administration and to our stakeholders, and constantly trying to balance all of that and still be true to ourselves and who we are. And that is another vulnerability we bring in with us. The ethical considerations here, why we talk about ethical considerations, we talk about compassion, fatigue, and self-care, et cetera, is because the research is pretty clear that when we're stressed, when we're not practicing self-care, when we start to have a reduction in our satisfaction with our employment, we're more susceptible to burnout. We're more susceptible for making, mistakes or turning to poor coping strategies. These are things that, we can see over time, even before COVID hit. But now with COVID, we're still, many of us, working in survival mode. We're probably, I suspect many of us are from different parts of the country. I'm here in New York. I've worked predominantly in New York City. Our second surge or third surge, or however we want to label it, has already kind of come. There's been some softening in kind of the stressors around us. Things have kind of altered a bit. But I'm also in Long Island, and here in Long Island, I can go into a restaurant without showing my vaccination information, where if I go into Manhattan, that's changed. You have to show your vaccination status to get into indoor dining. So there are differences even in my area where we're dealing with various stressors. We also know in other parts of this country, things are ramping up and people are stressed and things are difficult, and balancing both the mandates and the policies and the care and our own personal belief systems becomes something that, again, is a lot of pressure from us, and that starts to impact our ethical behaviors and how we work ethically. We know that the traumas of the people we serve, we take those in. We are susceptible to that as much as we're susceptible to our own primary traumas. And we know that burnout is real. Now, burnout becomes that systemic issue where it's our response to our environment, but the lower our ability to deal with our compassion kind of fatigue or empathy strain, however you want to define it, we'll talk about that in a minute, does impact our ability to manage some of that systemic stuff. And in the last number of years, we've seen, and in most professions, I believe people are getting to the point where they're leaving, and there's a reduction in our workforce. And those workforce influences, again, impact those of us still on the job, those of us still managing facilities and staffing. And we're now asking more of staff, we're asking more of ourselves. And that, again, adds to our vulnerabilities overall. So ultimately, these outcomes, all of this plays a part. So we gotta take a moment every once in a while to sit back and acknowledge kind of everything on our plate, what we're going through, because none of us are immune. And that becomes part of the problem that we're often confronted with, is we're very good at, the reality is most everybody that's on this call, and I would think, I'm going to take it back. I think everybody on this call went into their profession for a reason, because there was a calling, there was a purpose for why you're doing this work, why you're a caregiver. And sometimes that gets lost because of all of this, because of all the stressors, because of all the other rocks we have to carry up the hill. That impacts the reason that we're caregivers. But your basic character doesn't change so much. So that's what makes us start to be impacted by compassion fatigue. There's really no standard definition for compassion fatigue. It kind of varies based upon the theorist you're looking at. But I'm finding more and more recently, and this comes out of a move by Dr. Mathieu up in Montreal, this kind of move to saying empathy strain. And I'll explain why. And I think it makes a lot of sense to kind of say more empathy strain than compassion fatigue, even though definitionally they really kind of we experience it the same thing. It's just a new way to define it. And this comes down to more actually a physiological issue, in which empathy strain is looking more at a physiological response to how we respond to the pain of others. So empathy strain basically looks at kind of those when we're in a good place and we're dealing with people, our compassion is up. When our compassion is up, we kind of have that oxytocin release, we have a feel good, and our compassion kind of builds us up. On the other side, empathy is our response to others, and that's what starts to kind of get strained, our ability to respond to the emotional experience of others in a meaningful way. So compassion involves empathy. They kind of go together, but compassion builds us up, while empathy is what starts to kind of get eroded by the work and the stressors that we do over time. It's more of an unconscious, a biological response. And that's kind of why I think that they're talking more about empathy strain, because if it was compassion fatigue, it really just means a depletion in compassion, where overall it's our empathy starts to get strained. Now, we talk about this often as the idea of a contagion, because this comes often from those we work with. It's not only our own traumas and stressors that we have to really deal with, it's also our ability to deal with the traumas, or those vicarious or secondary traumas of those we work with. Those could be our peers, it could be our staff, it could be our management, it could be our clients, our patients. It can be our friends. The more we start to manage and deal and respond to the stressors of those around us, because we're empathetic and caring individuals, we start to emotionally respond to that. And that really does start to kind of impact us. So the paradox kind of emerges that our goal is to help people, and that help people who have been traumatized. And in the end, there's that kind of deleterious effect on us ourselves. But by helping them, it's still an act of compassion, but it still has that impact on us. So that becomes our paradox, is the impact of how our drive to help others really does start to have a hard kind of impact on us. And what makes us as individuals very susceptible to this type of thing is there's a lot of different things, and you're going to see some of yourself in this, or even people the best and the brightest, right? People that really care, that put themselves, highly dedicated individuals are more susceptible to this because they put themselves out there. They're really involved. Those that work to their own detriment, to their own risk for a result, to achieve results, people that are actively want to help and have positive outcomes in their patients or in their staff or in their organization, they're going to work even when they maybe should step away and don't want to take care of themselves. Those with low compassion, self-compassion, those that are not gentle on themselves, vulnerable. Excess empathy, to the point where we start to forget where our boundaries are, where this is not mine anymore, but this is theirs. And when we start to lose that boundary, our empathy does start to strain. Able to tolerate exhaustion for results, working way too many hours. I suspect a few people are nodding their heads on that one, because I think that's something that many of us do. That's and working from home makes it even tougher. If you're working from home or you're doing a dual kind of hybrid home and work, suddenly it's 8 o'clock at night and you're still working. It becomes part of where we are. Often we're not kind of doing that good separation, particularly in today's environment. Where we can identify with the victims, or we bring in our own previous traumas and are able to even more wholly put ourselves in the shoes of the people we're working with. And I think that is very true right now, because we may be working with people that are dealing with COVID, that are dealing with quarantine issues, they're dealing with inability to be with family, or have been very isolated for so long. And we can feel that, so we can identify even more strongly, because it's such a shared experience for so many of us. Poorly established or unavailable supports. If you're not using your support systems, or you're working with people with poor support systems, boy, does that impact our ability to really have a healthful place to process and be, and to kind of find our grounding and those that care for us. Your general poor health, mental, physical, and our avoidance for actually asking for help. And that's kind of something to think about for many of us in our professions. We're pretty good at being the first one in the front, front of the line, say, what can I do to help? I'm here to help you. But then we forget that needs to be us sometimes. And there becomes this kind of ethical dilemma of, well, I'm supposed to be able to deal with this. I'm okay. I don't have to do this. I don't need help. I'm good. I'm supposed to know this. This is my profession. I talk about this all the time. But we forget that we also need to ask for help. And often it's those of us that, protest too much that we don't need help, are traditionally the ones that really do need help as well. Some of the additional factors for things like compassion fatigue or empathy strain, whichever term you want to go with, are things like workaholism, which kind of goes back to what I said before, are really high caseloads, when our caseloads are almost unmanageable. Our own kind of history of traumas and what we bring to the table, our own baggage, not using supervision well. This is something becomes a systemic problem that we really want to consider. The idea of a non-supportive work environment or poor support social network. For people that understand, we need people both inside the structures in which we work to support us, and those outside in both. Peers are so important, because they may not walk in our shoes, but boy, do they walk right along with us. So they will have a better idea of a lot of what we go through. And then poor self-awareness, those that are not really seeing what they're going through and not able to kind of come to that in a meaningful way. All right, so when we're going to kind of define compassion fatigue or define empathy strain, whichever kind of terminology we want to use, I kind of like this one, the broadly defined concept that can include emotional, physical, and spiritual distress in those providing care to another. It is associated with caregiving, where people or animals are experiencing significant emotional and physical pain and suffering. And I like this because it doesn't just limit compassion fatigue or empathy strain to our professional lives, but also can be something we conceptualize within our personal lives. This does make a difference for us. So we do know that over time, working in really emotionally charged situations, particularly if we have limited resources or we're having to deal with our own traumas or our own stressors at home, our empathy gets taxed and we get exhausted. And if we're not really good at, embracing self-care or our own resiliency, acknowledging it, or really looking at our coping strategies, we really start to become susceptible to compassion fatigue. And compassion fatigue really kind of displays itself in all aspects of our life. It can look a lot like PTSD, or let's say PTSS, post-traumatic stress symptomology. You can have physical symptoms, GI problems, pains, problems sleeping. I've been hearing a lot of flashbacks recently. It can change our worldview. It can even make an already unsafe situation feel even more unsafe and unmanageable and hopeless. Compassion fatigue can come out in our personal relationships. It can play out in the choices we make for coping, where we may have stopped kind of an unhealthful coping strategy in the past. We may turn to that again during times of compassion fatigue when we're not really taking good care of ourselves, or we're starting to have the kind of our resiliency and our own coping strategies become overwhelmed and become stressed, is when the stuff can start to show up. It plays out in our interpersonal relationships. We can be angry. We can have what they call the silencing effect, where you just don't even want to talk about it. Anytime a topic comes up, you change it. We push things away. We can avoid, or we could do the opposite. We can work harder. We put ourselves in an even more vulnerable situation. But most notable, really, and kind of for our discussion today, talking about more positive outlook, is the idea of it changing how we look at the world, our idea of hope, our outlook, our sense of safety, and that sense of control. And that's part of what we really have to work to kind of gather back into ourselves so that we can work towards what I'm going to introduce next, which is compassion satisfaction, which is going to help bolster us to continue doing the work we do. I think we talked the last time quite a bit about the history of compassion fatigue and what it came out of. It's been around, the terminology has been around since like 1992, really kind of came out of both work in the psychology field, but also the work in the nursing field, particularly oncology, pediatric oncology nurses, really looking at the impact long-term of that. There's a lot of different ways we term this: compassion fatigue, secondary traumatic stress, vicarious trauma, the contagion effect. There's a lot of that goes into defining it. I think for each of us, we have to kind of embrace the definition that works best for us. I like this one because I think it captures most. A couple other considerations, and you're going to hear quite a bit about the stuff as we go along, and I'm sure some of these may speak more strongly to you. COVID fatigue. And this is something that we're seeing. This is the idea of living in this constant state of sympathetic nervous system engagement, constantly in the state of fight or flight, where you're almost always a little elevated, a little stressed. And because of that, we are very reactive in how we kind of deal with what we're given. COVID fatigue means that we are not getting a break. The idea, and I thank you for this, Christy, the idea that we've all got all our balls in the air, and we don't have a lot of places where all those balls aren't in the air. And we're always in that state of I'm trying to catch up. So COVID fatigue is something we often talk about now as well. We kind of know that these stressors may come and go. We may have moments where it's less and moments and more, but there is this undercurrent on a real national level of fatigue with some of our protocols, some of our policies, some of our standards of care that we ourselves are engaging in from our own choices. The idea of being out of control, of not being in control of what's going on. Another thing to bring up is this idea of moral injury. And this is becoming more and more a discussion. We're seeing this more and more discussed, where we may not have been seeing this as much last year. But this kind of goes along with the idea of anger. I'm hearing a lot more of this. People that are working within hospital settings or in rehab settings with people with COVID who are coming in with COVID because of the choice not to be vaccinated. And a lot of people are angry, and they're angry that they're having to help somebody who made this choice. And then there is this idea of, but in the end, my job is to help somebody, but I'm conflicted in helping them. Moral injury and our discussion about moral injury really does come out of a lot of talk from more of our military experiences. The ideas of, I don't believe in killing, but my job is to kill, kind of that conflict. And so we're seeing this too now in a lot of our frontline workers. And I suspect in even many of the rest of us in our other jobs, the idea of, this idea of kind of feeling kind of betrayed or the sense of betrayal by people that we're supposed to take care of, and anger at them for their choices. But that conflicts with our idea of do no harm and care. I'm not sure if that's come up for anyone out there right now, but it is something that is on the table and being discussed as well. Also, the idea of caregiver syndrome, which kind of falls into all of this as well. This is the idea of who we are, that we are caregivers, that this is part of our life. It's probably our life both on the job and not in our job, that we are constantly put ourselves in environments that are very emotionally challenged. It's part of who we are. And because of that, we're constantly putting ourselves in situations that make us susceptible to the stressors that can lead to compassion fatigue as well. So as you start to even think of your own mission statement for who you are as a professional and individual, consider, where is that caregiver part of yourself? And the other part of that we often talk about is not just that part of your own caregiver, but where is that also that part of self-caregiver? So where do you fall within that? Burnout and systemic changes is something else that's also being discussed. People, as I said before, we're seeing a lot of people leave our healthcare professions. And because of that, there's people are working even harder, which makes a lot of times leads to more of a systemic situation where burnout is potential. But burnout in itself is more a cumulative thing. It's over time. It's based on the environment in which people work. It can start to intensify based upon environmental stressors. And it is different than compassion fatigue. Compassion fatigue is much more when your own internal resources get strained, but the two do play off of each other, where burnout can play a role in how we perceive and process our compassion satisfaction. Okay, so what keeps us well? This is the big thing, right? Why are we here? What keeps us well? What can we do to make ourselves well? What can we do to keep ourselves, doing what we do and in charge of what we want to be in charge of and having good quality of life? What keeps us well? And these are the concepts I really want to focus a little bit more on. First is this idea of compassion satisfaction. So often we talk about what's wrong. I have empathy strain, I have compassion fatigue, but we don't always focus on what is right. What keeps me going? What keeps my satisfaction up, which keeps me on the job, which gives me satisfaction and gratification from being a caregiver, from being a healthcare professional. So this really, the more we can connect with our compassion and our empathy, it brings back this idea of compassion satisfaction. Compassion satisfaction in most cases is defined as the pleasure and satisfying feeling that comes from helping others. And when we have dealing with all the other stressors, this is what starts to also get strained. So I'm going to look a little bit about what this looks like and see if you can find some places in which you see yourself in that. Self-awareness and self-assessment is a big part of this, being aware of your own hardiness, resiliency, and coping. We're constantly needing to reflect. The more we do that, that can help to keep us well. And that becomes something we often forget to do. We're very focused as caregivers and as care professionals on what's happening with others. We don't often self-reflect in that. And that's something that we really need to kind of embrace as well. Coping and resilience, and I'll touch on these a bit in a moment, but coping is usually how we respond to a stressor. It's in the moment how we cope, while resilience is how we're changed by those stressors, how we come out the other side. Coping is something we can do very healthfully, sometimes very unhealthfully. It's something that we constantly need to reassess our coping strategies. Sometimes we start to cope in maladaptive ways because they're comfortable in what we know, and we often have to go back and readdress them, especially if they're interfering with our own well-being. And resilience on the other side is, as I said, is how we kind of adapt to the hardships and the stressors that we're facing. Resiliency is an interesting one. I always think resiliency is like the rubber ducky. You can put a rubber ducky underwater, but it always bounces back. That's kind of what our resilience is, how we cope back. We're not born with our resilience. Resilience is a constant, organic, growing component of our lives. It comes out of every stressor and every moment we're confronted with. And we can actually even gain this idea of vicarious resilience coming from watching how other people bounce back from things and being able to be open and learning from how they have reframed negative experiences, or they've been able to find that more positive spin or optimistic bounce back, or, improving their sense of well-being based on how they've responded to their own stressors. That can be a very positive way for us to embrace resilience. We'll kind of talk a bit about that again. And then self-care. Self-care, obviously, self-care is not the end all be all. Self-care is not the same as resilience. Resiliency is not self-care. Self-care helps with resilience, but they are kind of two different things. They kind of enhance each other. We know that self-care does improve compassion satisfaction. Self-care can bring greater self-awareness. So all of these things really kind of influence and play off each other. They each kind of build on each other and help us to survive through difficult times and help us to thrive, not just survive, to actually help us thrive, to come out better on the other side, as opposed to just surviving through what we're going through. So compassion satisfaction of itself is that ability to receive the gratification from caregiving. It's vital in our work. It's something that we need there at sometimes to keep us going. Sometimes we actively seek and try to find it and hold on to it, but it does fuel. It fuels the work we do. We need to be able to hold on to that. When it becomes strained is when people start to be more susceptible to burnout, to compassion fatigue, for making poor decisions or poor outcomes in the quality of care. It definitely starts to undermine those other parts. And it also, compassion satisfaction buffers against the negative impact of traumas. Interesting that there's some interesting research came out of California looking at healthcare workers in the hospital system there. And as much as so many were acknowledging their impact of the traumas on the COVID lines, of the impact of not having, a full workforce of people living, they really still had this high level of hope. It's that high level of hope that keeps people there, that keeps people working. That level of hope is what causes people to reach out for help when they're starting to feel themselves sink, or they're starting to feel the impacts of the traumas of the work they do. That is a form of this compassion satisfaction, for people to be able to really still find some reason to do what they're doing and to find that fuel. And that's what we really want to tap into. We want to tap into those things that help to keep satisfaction high. And things that really can help to improve compassion satisfactions are everything from good supervision, for positive social support systems, both professionally and personally, positive team interactions, people having and feeling like they have a solid place to kind of land work, some kind of efficacy in their workplace, that they have a say, they're not just kind of victims of an environment, and constantly finding ways to improve and train and improve educational levels to bring people up to learn new things. Things that reduce compassion satisfaction, increased work hours, things that are almost unmanageable, work drain, not being emotionally kind of self-aware, histories of own and unresolved traumas, people avoiding reaching out and asking for help, So it really comes down to environmental discussion of how do we get people to start to utilize those types of their own skills and their own kind of characteristics to refuel and reburn compassion satisfaction. And when we look at this, we look at the characteristics of what compassion satisfaction looks like. We look at all the things we talk about, all these kind of catchphrases, everything from well-being to revitalization and gratitude and hope. Each of those are characteristics of compassion satisfaction. And at any given time, it will look differently for each of us, but these are the kind of things we want to tap into. What we bring to the table that helps to feed that compassion satisfaction are these antecedents, the reason you got into the job in the first place, your mission statement, your levels of empathy, your ability to support and be present in stressful moments and to be responsive. The three key words we're talking about: resilience, coping, and self-care. Work-life balance. Ooh, such a hard one right now, is being able to manage and keep that in adequate supports. And then the ultimate, the having good compassion satisfaction, what does that look like on the other side? It improves our competency, our engagement in the work we do. It helps to buffer those stressful moments and those traumas. It kind of combats against compassion fatigue and burnout. And it helps us to be more positive members of our profession. So I think ultimately our goal is to find and kind of help, even personally or systemically, how do we help each other to develop our resiliency, coping, and self-care strategies. And I see work-life balance as being part of self-care as our kind of adequate supports so that we can have kind of these outcomes. So people are feeling the satisfaction of what they're doing. They're able to manage to some degree. Now, granted, we are in such a unique environment right now and such a unique experience that compassion satisfaction may be something that's a little harder for us to find right now. But the more we talk about it, the better we are. The more we can see and embrace these ideas of resiliency, coping, and self-care, and we can support them in ourselves, role model them in ourselves, open ourselves up to those we work with and our peers to make these part of our discussions, the better we can be, I think, in the long term, in being able to find and build more of that compassion satisfaction so that we don't burn out and we don't all kind of push ourselves to the point of kind of burnout and looking for other professions. So the idea of resiliency, again, is our adaptive behaviors because of our adversities, because of our traumas. Key word here for me is positive adaptation. I want to push the idea of thinking about these things from a positive point of view. When we look at things from a strength-based model, we're really looking at this stuff from a positive perspective. So resiliency is our positive adaptation. The ongoing thing is how do we approach something that's a trauma or a stressor or something that can look negative at first light? Are we able to learn from that? Are we able to learn from our experience of that stressor and find a way to reframe that and to approach that and learn from that lets us adapt more positively so it doesn't become an enduring scar, an open wound? It's something that we can actually move on and take what we've learned from that to make us stronger and better in the future. So when we look at this kind of adapting, it's our ability not only to cope with stress, it's not the points of where this intersects with coping, but how to manage the emotions, how we kind of build and take advantage of our own mental toughness and hardiness, and how we kind of bounce back, how we find meaning, how we find positive meaning in the experiences we had. It's about how we kind of adopt that kind of mental attitude to deal with adversity. That doesn't mean excusing it. It doesn't mean some kind of toxic positivity where everything's okay, nothing's bad. But it's really looking at what's the attitude we use to adopt to kind of the hardships that we deal with. Resiliency is not about recovery. It's not that. It's really, we're looking at how are we bouncing back? How are we taking this moment, this experience, and coming out of it on the other side? We survive. That's kind of our negative emotions, our fear, despair, our anger. These things are kind of more of an immediate response to survive in the moment. When they endure, they can become more dysfunctional and problematic for us. But when we're able to thrive, we're able to take something out of an experience and find some way to grow from it and to help it change and impact how we deal with these types of stressors in the future. So when we look at the intersection here about building our own resiliency, we are looking at different types. Did I go too far? I don't think I did I? Let me see. What? No, I did. I knew I went too far. Oops, it didn't like me. It went to here. Coping versus resiliency. There are two sides of kind of the same coin. One being your response. That's our coping strategies. The other ones is how we kind of bounce back. That's your resiliency, how we are adapted. So both are very important, both things we want to look at. We want to be able to, in the moment, deal with our emotions, perceive reality, think rationally, and be able to, know what we're in control of and know what we're not in control of, and kind of focus on problem solving so we can get through that immediate stressor. That's how we cope. Many of us daily are going through coping strategies. On the other side is the resiliency, is how do you bounce back? So once that stressor is passed, or you can get some kind of distance to look at the stressor to be able to come out at some point on the other side, how are you adapting to it? Now, resiliency is something we fall back on throughout our lives. And it's something that even in my profession, I'm constantly telling people, well, how did you deal with a situation like this before? What did you learn from it? What could you take from that to use now? That's our resiliency. Coping is in the moment, those things that we kind of put together and help us to respond. Both are easier, both are important in maintaining kind of our positive, the positive factors around us, like optimism, ideas of control, self-esteem, positive social interaction, all of these two things are very important when we can make those kind of considerations. So when we look at this, when we look at kind of what comes out of this, the ideas of our coping strategies, let's look a little bit here. The coping strategies of again, I went too far. Sorry about that. When we're really looking at building resiliency, it is really embracing and understanding the coping strategies we're also using. And we want to think about using various types of coping strategies. And each of these in and of itself are types of ways that we build our resiliency. It's ways in the moment we can come out of it on the other side with a more positive outlook. So when we talk about something like emotional focused coping, we're looking at things that being able to, with a lot of situations we can't change, but we can learn how to deal with the emotional response to that situation, or our perception of it, our cognitive processing, the ability to deal and cope with the situation by expressing our emotions instead of sucking them down or bottling them up, and learning to utilize different skills to kind of calm. Problem-focused coping is looking at ways to alter the situation or the source of stress, to know what our own limitations are, what we can and can't change. And if we need to, what type of coping strategies can we implement in that moment so that we're able to endure and to proceed and to kind of take control or influence our responses and the impact of that stressor around us. Active coping strategies are really taking action. What kind of goals, what kind of plans? And this can go into everything from, making goals on how to deal with the stressor to something as simple as time management, knowing where your limits are, what you can or can't do, what you need to delegate, what you can't manage on your own. And that kind of comes down to active coping, really taking and looking at how you actively manage in that moment. Acceptance, this is accepting and realistically accepting, our limits, both personally and professionally. Where do we have to say no? Oh, such a hard word to say. Where do we have to say no? Where do we have to say, this is my limit? And we have to be realistic about that. We also have to understand and accept at what point we can or can't control the events and the people around us. And being able to change kind of perceptively what is insurmountable or what is part of just living and what do we kind of need to accept. And in that acceptance, learn again how we manage and how we cope and what type of active plan we have to deal with that. And part of this, and when we look at this acceptance, also is that idea of flexibility. Flexibility is important. It's not always going to be great, but sometimes it's hard to be flexible when we don't feel safe. But that's part of the acceptance. Humor, believe it or not, humor is immensely important. The research on humor is pretty significant. We as adults, it's sad. We really should be more like kids. Kids from the research show they laugh about 150 times a day. Adults about 15. Just a little bit of laughing goes a long way. Being able to find humor, and I'm not talking humor in a self-deprecating way, but humor in our lives, to find humor in humorous moments in our existence. Being able to laugh with ourselves, to be able to find enjoyment, find those moments of gladness around us. And I'm not saying, you have to be happy all the time, because that often is a false front. But the idea of being able to boost our mood periodically and find things around us that can be healthful. Positive reframing and self-talk. The idea of being able to change how we phrase stuff, changing the musts to things like I desire to, I want to, I choose to, changing that I need to it's important to me, how we reframe what we've experienced and gone through, how we see problems as opportunities instead of only problems. Is there a way that we can put on our own glasses that are not always dark colored, that are not always looking at things as being against us, in a way that it becomes a challenge for us to overcome. Take advantage of your social supports, be proactive, ask for help, engage with people around you. Gratitude, give thanks to yourself, give thanks to others. Find a way to really embrace these challenges as a moment that you can find some type of awareness of your own successes and the successes of others, and have gratitude towards that. Reflection and awareness, being able to reflect on the experience you've gone through and your awareness of what that looks like, as well as compassion to self and others. That's probably one of the hardest. We're not really good at being compassionate towards ourselves, of, being comforting to ourselves or using kind words to ourselves. But that helps to build our resiliency, is being compassionate to ourselves and to others. I put this in here because I think this is important. I obviously stole this offline. Optimism is an important component here. As we said, positive, that's positivity, optimism. This is a very good idea, the idea of realistic optimism, not toxic positivity. Not everything's golden. We don't need to go down the Pollyanna-esque track. The idea of being able to find some genuine optimism in what we do. And there is a lot of research on the positive outcomes of optimism. The research on the impact it has on anything from reducing breast cancer to improving heart, cardiovascular responses and heart attacks in men. The research shows that people that are more optimistic and positive have longer and healthier lives, have higher self-esteem, they recover better after illness. The more that we can be healthfully positive and optimistic can kind of lead us towards better outcomes, especially during these stressful times we're confronted with right now. There's this idea of the magic ratio in positive psychology that talks about how many positive thoughts or positive statements we may make in a given time compared to the negative. They usually say we're languishing, we're not doing well if it's a 1-to-1, and our goal is to thrive, which is like I think it's a 3.7 positive statements to 1 negative statement. Ultimately, we should probably look more towards the idea of 5-to-1. Can we make those positive statements? And it may sound silly, but it can be anything from, at the end of the day, writing down positive things that happened to you that day. Even, I don't know how many people journal. It's something that, us clinicians love to make everybody do, but we're not so good about doing ourselves. But the idea of, even if it's, you're just going to complain about the day on one side, and then the other side of the journal start the other, list 5 good things that happened. The idea of at least having and embracing that moment where you can see the good. One of the things we work really hard in, and I work hard in my house, instead of asking my husband, how was your day? I ask him, what's one good thing that happened today? And you can even do that with each other, with the people you work with, as a way to focus on the positive and start to have a little better balance with the negative, because we're pretty good at finding the negative. Last but not least, the idea here of self-care. And I know we're getting down towards the end and I want to give some time to talk. So I will kind of run through this a little bit. The idea of moving towards a culture of self-care, it needs to be something that's central to our well-being. It's central. It's not just a response when things go south. It should be something that's part of our ongoing kind of embrace of how we approach things. Self-care, where we're often are embarrassed to ask for it, we're embarrassed to engage in it. Somehow it makes us weak. We may not need it. Somehow it shows us as not being, healthful. But we know from research, we even know from our own experiences how important it is. So we want to work and focus on wellness, optimism, self-awareness, make it part of what we do, part of our daily activities. We want to know learn our warning signs when maybe our own resiliency starts to get taxed a bit, and that we're not able to deal with things in the same way we did because maybe there's more stressors or we're more vulnerable. So in that case, we may utilize more self-care or other strategies to help maintain our coping so we don't go into compassion fatigue. And we want to engage in it before it's needed. We really want to know what we do and how we do it so that we can utilize it before it becomes a problem. We can be micro or macro. It can be the little things that you sprinkle through the day, your own mantra, the way you look yourself in the mirror and say, you're amazing, or somebody else looks at you and does that. It can also be macro. It can be starting, taking a class or going for a run. You can look at it in multiple parts of your life. It is something you do that is intentional. It's something you do that is not selfish as much as we think it is. And it really should help us contribute to finding balance and keeping going. And find and embrace that sense of wellness again and being able to kind of enhance our quality of life and our sense of fulfillment. It is not resiliency. It is not hardiness, even though they feed off of each other. This is something is more of kind of building us up and kind of maintaining our stress relief. It's our mindfulness activities. It's things that we do in our spiritual life. It's things we do in our cognitive life, our educational life, and our work life. It is resiliency is how we respond to trauma, our stressors. This is kind of how we maintain our daily life. So we're better able to actually respond to those stressors when they confront us in our life. So you need to be aware of your self-care. It's got to be yours. It's unique. It is yours and only yours. And I have heard many self-care activities that I wouldn't do because they're not me. And I have those that I do that may not be yours, and that is okay. But it does become something we do intentionally, and we do it and we improve on it and we change as we go through time. We got to constantly reflect on it and look at it. It is something that helps us to balance. We talked a little bit about vicarious resilience. That can be part of our self-care, is learning what other people do, how other people come out of things. And that can then also inform different type of strategy we might use for us overall. This is a great handout. I know she's going to put this up. Again, this is a great thing you can get to from getselfhelp.co.uk. This is a nice little handout about positive steps you can take for your own well-being. That looks both about healthful and unhealthful coping strategies. That I will say that one of the things we have acknowledged and people have acknowledged that during these COVID times, people dealing with stress have reached for the bottle, and we want to be really conscientious about not falling back on things that might not be helping us cope, but might be impairing our ability to cope. But things that build you up, look at this, how we eat, how we sleep, how we connect to others, how we accept. This is very much what we've talked about. Seen this before. Consider your self-care in multiple parts of the self. At all parts, try to find balance, try to figure out what area you might not be embracing self-care in. Where might you want to build it up? Are you spending enough time outside? Are you breathing enough real air? A lot of people who spend their entire career right now in masks aren't finding times to take it off. And that's super important. I put this up here for anybody that wants, let me know. I will send this to you. I just love this. I think this is a really important thing for us caregivers, that we forget the things we need to do for us. And you need to have your own Bill of Rights. what's good for you, what's important. And, I think the more that we see ourselves as being an important component in all of this, the more we can maybe give ourselves permission to feel better, to find those times to build our resiliency, embrace it, and build our coping strategies and build our self-care activities, thus kind of breathing a little life and refueling our compassion satisfaction. Now, for anybody interested and anybody that's dealing with the impact of COVID-19, I do encourage you to check out the emotionalppe.org site. We do connect people with free and confidential mental health services by state. If you know of somebody you think is struggling, please pass this on. If you know of clinicians that would love to get involved, please also pass this on. We're always looking for more clinicians. We have just about every state, but there are states we really want to build in. So that's it for me right now. Christy, do you have any questions? Does anybody have anything they want to bring up?
Thank you so much, Kimberly. That was absolutely amazing. I was taking pictures of the screen as you were going. I know you're going to send that PowerPoint presentation to me so that I can, share it with all of our attendees and those who weren't able to join us live. But there was some really great text in there and some really great suggestions, as we all are in this together. But in order to be in this together, we have to take care of ourselves. Yes. So it is very important. I know a lot of us struggle, especially those of us who are caregivers. It is a struggle to take care of yourself. So it's a great reminder of that self-care. We do not have any questions, but if anybody has any questions, I encourage you to use the Q&A box. We just have like 2 more minutes left. You can ask your question anonymously. If after the webinar, if something comes up, please do not hesitate to email me here at NARA, and I can get your question to Kimberly. But as Kimberly mentioned, the emotionalppe.org is a great resource for anybody. It's not a question, but more of a comment we received from Lynn. Great information. Thank you. Constance said, thank you for sharing such thorough and uplifting information, Kimberly. So definitely agree with that.
I just hope everyone takes away the idea of positivity. We talk so often about compassion fatigue and strain and all the negative, and the more we can kind of look at our strengths, we forget how strong we truly are. So I think more we can embrace that, just the better off long term.
Definitely, yes. And I think I want to challenge everybody who has joined us today. I think the biggest thing that I took from what you said was, you said that you don't ask your husband anymore, how was your day? You say, what was one positive thing that happened? And so that really stuck with me. So, I always ask that when my kids come home from school or from work or whatever, like, how was your day? So instead of asking your kids or your spouse or your partner, when they come home from school or work today, ask them, what was a positive thing that happened to them today? And I think that will completely change their demeanor if they've had a rough day. Yes. So I challenge everybody to do that.
I appreciate that. Yes, it's a great challenge. It's a tough one to do because we really get stuck there, but
we do. We tend to focus on the negatives and not think about the positives. And there are positive things that happen to us throughout the day. So.
Absolutely.
All right. Well, we have hit our hour. So thank you so much, Kimberly, for joining us again. You always are such a breath of fresh air, especially in these crazy times. So thank you so much.
Thank you, everybody.
Thanks. Bye-bye.
Bye.